When I think about Dr. Goldman, the first words that come to mind would be professional, friendly, very down to earth, gets what you want done. So he listens, that's the one main thing. He actually listens to what you want and makes sure the results are as close to that as possible. I first got in contact with Dr. Goldman last year. So how I met him was my mom has had quite a bit of surgery done with Dr. Goldman. That was the first time I met him. And then from there onwards, I started working for him not long after I met him. And yeah, that's pretty much how I met Dr. Goldman, through my mom, having appointments with him. And it was inevitable that not long after I was going to want something done by him. I've seen his work. I first spoke to Dr. Goldman about having breast augmentation done. It was probably January, the beginning of January. So when he came back from his holidays, I was like, I'm going to do it. I know the payment plans, I know what we're going to be doing. I've heard him speak about it many times. I know what's coming. So I booked myself an appointment and sat down and spoke with him. Then wasn't long afterwards, I had it done in May. As quick as possible, had the procedure done, knew exactly where we were going, and I got what I wanted. Even though I worked for Dr. Goldman, when I had my consultation, it was still like as if I was a patient, first-time patient. So he went through everything with me, we spoke about it, you know, pros, cons, everything that can happen after having the breast augmentation. Options, went through all the options. He asked me what I wanted, what was, the outcome that I would hope for. As he says, in a perfect world, what would your ideal results be? And I just pretty much said to him, I was like, this is what I've got, this is what I want, you just get me as close to that as possible. Everything in the first consult was a little bit awkward. It was my boss. But it was perfect otherwise, it was good. I was very comfortable with him. So he's got to mention all of the, what can go wrong. So he likes people to know everything. His consults can go on forever because he loves to explain. He needs to know that when you leave that consultation, you know everything. There's nothing that he's left out, which I prefer because I'm one of those people that will just jump into everything. So if you just say to me, yeah, no problem, we'll have it done, 5 minutes later, okay, I'm booked. So he makes sure that you understand every aspect of the operation procedure that you're having done before you leave that consultation. When I initially spoke to Dr. Goldman about having breast augmentation, the reason being was because obviously I've had 3 kids, breastfeeding, there was no fullness. So I said to him, I'm happy with what I've got, just make them fuller. But I don't want to be busty because obviously I've got 3 little kids I need to run around after and I don't want boobs that are like up here. And he did. I panicked at first when he said that a full C is going to be too small, I have to go D. I never really considered myself having D-size boobs. But no, they were perfect. Once after the operation, they were massive, but they settled pretty quickly and now they're natural, very natural. So I'm really happy. Actually, it's a lot better than I thought. It was very different at first because obviously now you've got this new weight in the front and you kind of don't know, you feel a little bit imbalanced, But after a week, you don't even notice it. And like I say, it's not heavy. It just feels fuller, like I forgot the last time they felt like that, and natural. They don't look like, you wouldn't say I've had like my boobs done. So that's one thing that was a really good thing. I didn't really want to have it obvious, if that makes sense. I've seen way too many people that just have very, very fake looking boobs. That was my one worry, but no. I wasn't actually thinking of having my breasts done anytime soon because, first of all, you don't know super care is an option. So you didn't know that there was payment plans in place for something like that. So I was like, great, I'm going to save for a very long time and eventually I'll get it done. But no, I wasn't expecting to have it done so soon because I didn't know that there was other options out there. But I'm glad that I did it with Dr. Goldman because I think going with anybody else and not giving me all that information that I needed, as well as he's very straightforward. He's very straightforward. which is a good thing. It's a very good thing. So if you come in there with unrealistic ideas of what you're going to turn out to be like, he's going to tell you straight away, you can get that thought out of your head right now. We can work towards it, but it's not going to go that way, which I prefer. I'd rather somebody be very straightforward with me and open, which is what I found with him. My experience with Dr. Goldman was so easy. It really was. There was no fuss at all. He moves really quickly, which is good. There's nothing worse for me personally than having to wait months and months and months. So the fact that he's got so many dates available all the time, and if everything's in place, he moves very quickly, which is good. But he also double checks with you about 100 times before, just to make sure and remind you, you need to take this seriously. This is surgery. But no, it's very easy. There was no fuss. It was a lot easier than I thought. I need to be comfortable, which that's one thing I found that was the best thing about doing this whole procedure with Dr. Goldman. You are comfortable, but he still makes sure that you know everything. You know what can happen, more than likely what the outcome will be. This is what we're working towards. First of all, Dr. Goldman preps you more than enough before you leave that room. So he comes back in after your surgery just to check on you before you leave, gives you all the do's and don'ts. You get little pamphlets. So with the aftercare, once you get home, there's not really much to do besides relax. Don't get the bandages wet for at least until the day that he's told you can have your first shower. He phoned you a day after. So once you've been home, a day after you've been home, Dr. Goldman will phone you just to make sure everything's good. There was hardly any pain. The only thing I felt after the surgery for about a week was very tight, because naturally you've gone up a size and everything's still swollen. But no pain. I saw Dr. Goldman not long after that. So if there's any issues, you've actually got his direct contact. So you phone him directly. But otherwise, you see him 2 weeks after surgery, then he takes the bandages off. So he's very involved in the aftercare. And if there's any issues, obviously, then you straight back in. So there was no issues there. It was very easy. It was a lot better than I thought, because when you hear, 6 weeks after surgery, you need to take it easy, no lifting, you kind of panic because 3 kids. I've got to pick up someone. Someone's going to want to be picked up. But no, about a week after, I was back to normal. Not doing like heavy lifting or anything like that, but it was so easy. Oh, you have no idea. Never done so much shopping in my life. Yes, no, they're really good. I had my 3-month checkup with Dr. Goldman last week. Super excited, because then we confirmed the actual size. I'm loving them. Just the fact that I actually have boobs now is great. I didn't have them before, so couldn't have turned out better. There's so many different options. You don't have to pay it straight up. There's, apply through your super, do a payment plan. A lot of different options.